Hello. On this video, I will talk on the prenatal diagnostic testing. Many of us uh, want to know what are the testing can be done during pregnancy to find out certain clinical condition regarding the fetal health. So let's start. What are the prenatal testing modality? So number one, chorionic villus sampling. It is the chorionic villus sampling. Mind it, the chorionic villi, it is the precursor of placenta. So it is the precursor of placenta, and it is the histological nature and chromosomal nature of this chorionic villus is identical to the fetus. So if any chromosomal abnormality of the fetus is there, the chromosomal abnormality can be identified by karyotyping of the chorionic villus tissue. So it is the number one important investigation, and this investigation can be done around 10 to 12 week of gestation. So it is the number one investigation which can be done early in the pregnancy to identify any chromosomal abnormality by karyotyping of chromosomal villus tissue. So this is the number one test, chorionic villus sampling, around 10 to 12 week of gestation. Next, the next investigation, number two, that is called knuckle translucency. Knuckle translucency. It is the knuckle fold thickness, that is the skin fold thickness over the nape of the neck of the fetus, and it is done by ultrasonography. And the optimum timing of doing a knuckle translucency test is 10 to 12 or 10 to 14 weeks of gestation, and it is done to identify a certain abnormality like Down syndrome, as a whole a trisomy like Down syndrome, Edward syndrome, that is trisomy 18, Down syndrome trisomy 21, and Petu syndrome trisomy 13. So this trisomy, as well as monosomy like Turner syndrome and congenital heart disease. In this condition, knuckle translucency test is very much important, and the knuckle thickness will be increased. And in case of Down syndrome especially, there are three tests which increase the sensitivity and specificity for the diagnosis of Down syndrome. The three tests are: number one, knuckle translucency, in short NT; number two, PAPA test, PAPPA test; and beta HCG, that is called pre-beta HCG. These three tests is very much important for the prenatal diagnosis of Down syndrome. Mind it. So now we will go for the next test. Okay, the next test, number 3, will be amniocentesis. Amniocentesis is the collection of amniotic fluid by percutaneous aspiration. So So it is the procedure of collection of amniotic fluid by percutaneous aspiration of the amniotic fluid from the amniotic cavity under local anesthesia or without anesthesia. Optimum time of doing this procedure is after 15 weeks of gestation. After 15 weeks of pregnancy. The amniotic fluid contain amniocyte. Amniocyte is the discomated fetal cell, that is fetal skin cell, and the fetal cell means it contains all the genetic materials of the cell. So the amniotic fluid sent for karyotyping, number 1, to see any genetic or chromosomal abnormality, and number 2, some lab test like alpha fetoprotein and acetylcholinesterase level to identify neural tube defect, okay, like anencephaly or spina bifida or other modality of NTD. So number 3 test is amniocentesis, which should be done after 15 weeks of gestation, followed by karyotyping and some lab investigation like alpha fetoprotein and acetylcholinesterase level of the amniotic fluid to identify neural tube defect. Next investigation will be number 4, that is anomaly scan. Anomaly scan, and these anomaly scan should be done around 18 to 20 weeks of pregnancy. It should be done around the 18 to 20 weeks of pregnancy. It can identify anatomical abnormality like congenital heart disease, then dilated or enlarged renal pelvis, short limbs, etc. So anomaly scan, it is important to keep in mind that the optimum duration of doing anomaly scan is 18 to 20 weeks of gestation. The next prenatal investigation will be percutaneous umbilical blood sampling, in short number 4-5 PUBS, that is percutaneous umbilical blood sampling. The optimum duration of doing PUBS is around 20 and after 20 weeks of gestation, and the goal of doing PUBS may be diagnostic or maybe therapeutic. Diagnostic means to collect fetal blood sample for analysis of blood gas, fetal blood gas, or fetal karyotyping if it is not done previously by chorionic villus sampling or amniocentesis. Then direct fetal blood sampling can be done for karyotyping, blood gas analysis, or to see any fetal serology by estimating a specific IgG or IgM. So fetal blood is very important for identifying any infection transmitted from the mother to fetus transplacentally. and it might be therapeutic also. In the sense of therapeutic, in case of fetal anemia, severe anemia of course, like ABO incompatibility or RIS incompatibility that might develop hydrops fetalis. We know in case of RIS incompatibility, where the mother is negative and father is positive and fetus is positive. In that case, the fetus may develop severe anemia and hydrops fetalis, and in that case prenatal, that is the before delivery, or the fetus may need blood transfusion. Fetus may need blood transfusion, and these blood transfusion can be done using the umbilical artery. So this is called intrauterine transfusion of fetal anemia. Okay, so intrauterine blood transfusion can be done by approaching the umbilical blood vessels. So this is all about the prenatal testing modality. So I can recapitulate shortly. Number 1, CVS, that is chorionic villus sampling, around 10 to 12 weeks. Nasal translucency, 10 to 14 weeks of gestation. Number 3, amniocentesis after 15 weeks of gestation, and anomaly scan then around 18 to 20 weeks of gestation, and finally percutaneous umbilical blood sampling after or around 20 weeks of gestation, and it might be diagnostic or therapeutic, most importantly. In case of severe fetal anemia, intrauterine transfusion of blood to fetus may be needed. So this is all about this video. Hope this video will be helpful for you guys. If you have any question or query or any comment, any suggestion, you can put your valuable comment in the comment box of this video. So thank you very much.